Well, you guys know our hospitals, well, they have been overwhelmed for almost a year now dealing with the coronavirus pandemic. Healthcare heroes are seemingly burning the candlestick from both ends. It's even forcing some to quit because they're so tired and even traumatized in some situations. Joining me now this midday is cardiologist Dr. Fahmi Farah. Dr. Farah, thank you for joining us this morning. Up first, I want to talk to you about Governor Abbott's decision to rescind all COVID restrictions in the state. What are your thoughts?
Well, thank you so much for having me. It's a pleasure to be here. Yes, it does make me a little nervous just because, we saw what happened just less than 2 months ago, during the holiday season at the end of December and especially January. Our numbers were so bad, we couldn't get patients into the hospital. We're having to transfer patients to other states in many cases because that's how full our hospitals were. And while our numbers are going down, which is a great thing, we still need to be very cautious. So yeah, it would make me more comfortable if we continue to wear masks for a little bit longer to get the numbers down a little bit more.
According to one survey, 69% of doctors were happy at work before the pandemic. That number dropped to about 49% after the pandemic kicked off. Talk to me about that.
Yes, you're talking about physician burnout?
Yes.
Yes. So it's incredible what our frontline workers have gone through, especially physicians and nurses alike. There are a couple of key things that are contributing to the amount of physician burnout that we're seeing. Number one is the long work hours. Over the course of the pandemic, it's been, a lot longer, in many cases, double duty. And the workload itself, while you're at work, you're having to see 2 to 3 times the amount of patients that you're used to seeing. So all that responsibility adds up. Additionally, the trauma, as you mentioned, this is something we didn't deal with before. Seeing so many sick patients and in many cases not recovering quite well, to not see them successfully leave the hospital. The death toll, it has an effect to the psychology. Doctors are humans after all. Additionally, when they're going home, in many cases, they're having to isolate themselves from their, from their families so that they don't spread the virus. So all these things are contributing.
Dr. Farah, what advice would you give to, a young student maybe that just finished nursing school? They want to go ahead and jump into the field, but they're afraid to do so right now. What advice would you give to them?
I would say do not let this, be a negative impact on you. In fact, we know that the pandemic, while there's increased burnout in physicians, it did increase the, youngsters' desire to go into the field because in many cases, physicians and nurses together have put forward their, heroic actions in many cases by giving up so much of their personal time and saving lives. So that should be the inspiration here, to save lives, to do good for the greater, the community and the public. So I hope, in fact, that this pandemic is not a negative light for the youngsters, that it's a positive encouragement to take your step forward and pursue this career to help people.
That's good. What do you think needs to be done, though, to ensure our best and brightest healthcare workers don't burn out?
Oh, I think support is needed at all levels. I think support from the administration at the hospital levels to reduce the number of hours physicians are having to put in, and also the workload itself. We need to have more physicians to divide the job. So support from all levels, at work level, and then, wellness. I really think that there needs to be programs implemented for wellness, exercise, mental health. That's something that we rarely talk about among the physician group. And in many cases, it's reprimanded. And I think that culture needs to change to make a difference and improve the mental health and the overall well-being of our physician community.
I think we're all at a point where we're really understanding the importance of checking in on our mental health and all of that. So, Dr. Farah, thank you so much for joining us this morning. Very good insight there.
Thank you very much for having me. It was a pleasure.
Absolutely.